State Dale Falwell. I want to thank you all for taking the time to join us for Ask Me Anything. We do this every month where we give every member of the international, national, statewide, or local press the opportunity to ask me any question on any topic that you like. A lot going on with the Treasurer's Office right now. We're gratified that the Senate unanimously passed the Medical Debt Deweaponization Act yesterday. Now it's on its way to the House with some great bill sponsors. I wanted to add that this is a pro-consumer, pro-family piece of legislation, and the stories that we continue to hear about the impact that medical debt is having on the living, as well as those widows and widowers across North Carolina whose decedents have run up enormous medical debts that's negatively impacted their credit score as they try to move forward in their life. So we're very grateful to Senator Krawiec and Ford and Bergen for championing this legislation. There's still a lot going on in the banking system. I am thankful for Commissioner Boskin and her staff who have been putting forth Herculean efforts over the last 14 weeks to make sure this lapel pin that has NC on it stands for nothing, no crisis. Another failure yesterday with First Republic Bank, and the State Banking Commission is working overtime to make sure that our state charter banks are in good shape. I wanted to also add that as we approach the summertime period, that there's also a lot going on at the Treasurer's Office. We will remain in the check delivery business. We smashed some new records this month with our retirement checks paying out nearly $600 million in gross benefits. This is exactly what I predicted 7 years ago when I applied for to be the keeper of the public purse. That is a annualized rate of over $7 billion in gross benefits. And not only did we smash the amount of benefit going out, we smashed the number of people it was sent to. I believe the number is about 365,000. So these plans have nearly 1 million people on it. 1 out of 10 adult North Carolinians who teach, protect, and otherwise serve. And safety and security of this plan is very important. With that, I'll be glad to take any questions anybody might have. Teresa?
No, Treasurer, I don't have any at this time. Thank you.
Thank you for joining us. Zach, do you have a question?
Yes, I do. First one I'll start with, can you hear me all right?
Yes.
Yeah, first one I'll start with has to do with
Zach,
yeah.
Sorry, who are you with? Thank you for joining
I'm
us.
with WECT News in Wilmington.
Oh my gosh, good to talk with you.
Yes, good to hear from you as well. I know this isn't exactly on topic, but I know you'll be talking about it later today. Wanted to get your thoughts on the city looking to finance the purchase of the Thermo Fisher building with $70 million of existing money, not funding that with a tax increase as their proposed budget suggests.
Zach, thank you for your question. And this item is going to be on the Local Government Commission agenda today for discussion only. We approach this the way that we've had to approach everything going on in New Hanover and County and Wilmington, North Carolina, and to some extent Brunswick County over the last 3 years. We're going to approach it with professionalism, but I'm sure the local government commission members are going to have questions about the transparency of this transaction and the governance around exactly what it is they're trying to do. It's not just this transaction. As you know, we've been dealing with for months, if not years, with Project Grace, the purchase of the Bank of America building by the county, the new government center. I've learned of a 3P partnership on the old government center in the county. So there's a lot going on down there, and I hope, Zach, that you have an opportunity to zoom into the local government commission meeting today to hear this discussion. I'm not sure exactly who's coming up from Wilmington today, but I hope that they will be prepared to answer questions that the local government commission has, and then we can proceed to get those questions answered. Do you have a follow-up?
Yeah, if you have any idea of what those questions might be. I know you can't speak for the entire commission, but what some of them might be that you have personally.
Well, it's the same kind of questions we always ask, because we have citizens who obviously are writing in here expressing concerns about this, and sometimes their questions aren't answered. So we feel like I feel like that to some degree that some of these questions that have come in from citizens need to be asked. Obviously, the first one has to do with not just the ability to pay, but the need. Secondly, the price. Thirdly, things having to do with transparency. Fourthly, if real estate markets can be different, but I can tell you, as I presume probably the largest real estate investor in North Carolina inside of our pension plan nationwide, that you're seeing a collapse in commercial real estate prices in many parts of North Carolina. And I say that to be very technical for a moment. Sometimes you don't see the collapse in terms of the asking price or the transaction price, but you see it in terms of the debt that is used to finance these transactions and how the cost of that debt has gone up. Anytime the cost of debt goes up, that means the risk of a transaction is going up. And so these are some of the things that we're going to address. I have a great working relationship with the mayor. I'm not sure if he's going to be here today, but we're going to treat the folks from Wilmington with radical hospitality, but we will be getting our questions answered.
Great. And then just one more question I had has to do with your, obviously, everything you've talked about with medical debt de-weaponization. We're almost 2 years now into the operation of New Hanover Regional Medical Center here under the branch of Novant Health. Still hearing some concerns from people about, those bigger brand hospitals, company hospitals, things like that. If you just want to sum up once again, why it's important to save these smaller private hospitals that we have out in our coverage area in Columbus County and places like that, and even in Pender County.
Well, it's important to save any healthcare facility that we have, but when we have CEOs who are laughing all the way to the bank with these multi-billion-dollar transactions that result in lower quality, lower access, and higher cost to the detriment of all citizens, but especially the middle class and the lower and fixed income people of that community. I predicted this over 3 years ago. I predicted this in Western North Carolina with HCA taking over Mission Health. We told the folks in New Hanover County, based on what we were already seeing west of Hickory, North Carolina, what they could expect to see. And it was like pointing a bat toward the outfield. This is exactly what's happened. Quality gone down, access gone down, costs have gone up. And what's so deeply saddening about both Mission Health in Asheville and New Hanover Regional in your neck of the woods, what's deeply saddening is that these were two examples, and there's not many examples like this, Zach, around the United States, of a high quality, high access, reasonable cost, profitable, independent hospital. And now you can't say that about either one of these entities. And as we predicted 3 years ago, this is what would happen. And I'm also predicting that it's going to get a lot worse for the people that the former New Hanover Regional Medical and now called Novant serves. It's going to get worse. It's not better.
All right. Thank you for your time.
Any other questions? Well, as I summarize, I appreciate your interest in doing this. Our thoughts and prayers go out to the Wake County Sheriff's Department. As you've heard this morning, that Deputy Ned Bird, the folks who were charged with his murder, are now on the loose after escaping from, I guess, a prison in Virginia this morning. And it's just another example of when you're a victim, things sometimes continue to happen. So our thoughts and prayers go with them. shout out to all the public educators. I believe this is Public Education Teacher Appreciation Day, and also to all of our state employees. This is May is State Teacher Appreciation Month. And lastly, I'll be remiss in not saying this. I think this is Motorcycle Awareness Month. Look twice and be nice when it comes to being around motorcycles. A lot of our citizens are not as used to seeing motorcycles on the road as much as they will be over the next few months, including mine. And so just a traveling mercies to all the motorcyclists across North Carolina, as well as and because it's not motorcycles, it's the motorcyclists who do so much for our communities. With that, our office is accessible to you through Frank Lester, Dan Way, and many others. Thank you for joining us, and hope you have a blessed day.